This Good to Go segment is made possible by Spectrum Health Medical Group.
A common problem for many people, hemorrhoids, can often become an ongoing complaint for many people by midlife. By the age of 50, about half the population has experienced one or more of the symptoms. Joining us today is Dr. Donald Kim, a colorectal surgeon at Spectrum Health. He's here to talk about what you can do if you're experiencing hemorrhoids. Good morning.
Good morning.
Okay, so first, what exactly are hemorrhoids?
Well, essentially, they're normal. They're normal. They're part of your anatomy, and they are
Really?
Exactly. They're vascular cushions, both internally and just on the outside of your anal canal.
Okay. Okay. So then, when does this become like an issue?
It's an issue when obviously they begin to cause symptoms that are related to the cushions becoming too large or they bleed. They can cause thrombosis, which is pain. Just some terrible, terrible things.
Okay, so
Yes.
what are some of the symptoms that people should be looking out for?
So, because it's something that's very personal, it's symptom. Yes,
Yes,
exactly.
yes.
Yeah. Nobody likes talking
Nobody
about hemorrhoids.
wants to talk about it,
I don't
but
like talking about
you
hemorrhoids.
have to deal with
So,
it,
They are essentially symptoms that the patient is complaining about,
Okay.
and that includes bleeding, pain, itching, all things around the bottom. So
Okay.
the thing that we see most of the time is there's something wrong with the bottom, and obviously it's going to be hemorrhoids, but not all things that affect the bottom are hemorrhoids.
So what are some things, or obviously this is a very common problem, but who often struggles with this?
Well, those that have had children, I think pregnant women,
Okay.
those types of pregnancy can increase pressures that would
Yes.
increase problems with hemorrhoids.
Okay.
And you'll find some patients doing that. Anyone that strains a lot, patients with chronic constipation,
Okay.
things like that.
Okay, now, you see stuff like Hemorrhoid Cream in the store. What about, what are some other ways to treat these?
Well, certainly there are the topical options or the creams that are used. And there's, if they work, that's great. But
Yeah.
if there's still symptoms related to your, quote, hemorrhoids,
There are other options.
There are other options. You should seek those out from a physician that has experience in treating hemorrhoids.
And what are some of those options?
So those include just simple things like increasing the fiber in the diet to higher levels. That sometimes takes care of a lot of the symptoms.
Really?
And then surgical options include things related to treating what are termed internal hemorrhoids, hemorrhoid banding, all the way up to surgical options where we would actually cut or excise the hemorrhoids.
Okay. Okay. Now, what are some things that we can do? You talked about, getting more fiber in your diet, but what are some other things that we can do to prevent this, problem?
I think it's all about your bowel habits in
Okay.
essence, and I think if you do this long enough in my field, it's one of the big complaints is constipation, and so
Okay.
trying to avoid that by, again, increasing the fiber. If that doesn't work, there's some other options and laxatives and things like that under the direction of a physician.
Doesn't drinking water help with that too?
Exactly.
Making
I mean,
sure you're
those
super
are things
hydrated?
making sure you are.
Okay.
hydrated, yes.
Okay. And then, I
So
think
you could do this. You could.
Oh, no, I don't even have any idea. I had to ask you what a hemorrhoid was.
Yeah.
I don't know what I'm talking about. I just know that, you always hear drink more water.
Yeah.
So
It's good for a lot of things.
So as far as, this is something that's pretty common. When does it go from something that you can kind of just take care of on your own to transitioning into, okay, you really need to call a doctor?
I think if there's rectal bleeding, I think because that is so many other things, that's important to check with a doctor. And again, anything that happens down there, everyone assumes that it's your hemorrhoids, but there are so many other things that can happen down there.
There are different issues,
if
yeah.
you're especially having pain or things like that, you should probably see someone that is able to treat those problems.
Well, and to be able to distinguish, is this a
Exactly.
hemorrhoid? Is this something,
Yeah.
or is this something that, we need to take a look at in another
Exactly.
sort of way, in another sort of test? But okay, so big thing, make sure you're drinking enough water.
Sure.
And then what's your other big tip?
I think the fiber, or keeping a lot of fiber in your diet, regular bowel habits is probably pretty important.
Okay.
Not a lot of straining.
Okay.
Stay off, don't read a whole novel on the toilet,
Yeah.
that type of thing. So.
Good to know, good to know. For more information and to get help, we've put a link on our website. Just go to wzzm13.com under the exchange.